Unfortunately, we have a epidemic of opioid use here in the United States. And with that, we've seen increasing numbers of people using IV drugs. Parallel with that, we've seen an increase in hepatitis C. And we've seen it among pregnant women at Magee Women's Hospital. Acutely, hepatitis C might present with fevers, jaundice, elevations in your liver function tests. And then it kind of goes through a dormant period where there really aren't necessarily any symptoms. The study medication for the HIP study is Harvoni, which is a fixed dose combination of a medicine called ladipizvir and sofosbuvir. It is a 1 pill once a day medication that treatment course is 12 weeks. A lot of times we just assume that the dose given outside of pregnancy is appropriate for a pregnant woman without any data to support that. So this study will fill that gap in knowledge with these new medications for hepatitis C in pregnancy. And sometimes during pregnancy is the only time that women seek care. So we hope to learn from the HIP study first to answer the question of whether or not pregnant women have the same drug concentrations in their blood as non-pregnant women, to know if we're appropriately dosing the medication in pregnancy. And then secondly, we want to get our first glimpse into whether or not these medications are safe in pregnancy. Anyone who is pregnant between the gestational ages of 14 weeks and 22 weeks can be enrolled. They have to have chronic hepatitis C infection, which means they have to have known that they've had hepatitis C for at least 6 months. It is 7 visits for the mom, and there are 3 longer visits that are between 13 and 14 hours long. And then an additional 3 visits for the baby. And then we'll follow the baby for an entire year, doing physical exams, checking for hepatitis C in the baby, and to make sure that there were no negative effects on the baby because of the study medication. We will also see her at her delivery time when she's in the hospital, and then see her afterwards to evaluate if the medicines were effective in treating her hepatitis C. This is the first study of hepatitis C treatment in pregnancy, and we hope this will give women a choice that if they do find out that they are pregnant, and they also at the same time find out that they are hepatitis C infected, that they'll have the choice of whether or not to be treated during pregnancy or not.